This video is made to help you understand what COVID-19 is and how to protect you and your family. So what is COVID-19? COVID-19 is a virus similar to many of the normal viruses we deal with in everyday life. The common symptoms of COVID-19 are fever, cough, trouble breathing, runny nose, sore throat, and sometimes throwing up or having diarrhea. These are the same symptoms you will see in other viruses, which can make it difficult to tell the difference. But that's okay, as most people will still recover without any problems at all. It is really important to remember that most children who get COVID-19 will recover just fine, just like they would with other viruses. It is safe for most people who get diagnosed with COVID-19 to manage their symptoms at home, outside the hospital. Later in this video, we will talk about what you should do when you're at home, how to watch out if things get worse, and when you should see a healthcare professional. There are a couple things that make COVID-19 different from normal viruses. First, this is a new virus that our immune system has never dealt with before. Although scientists know a lot about other viruses similar to COVID-19, new information on how to care for those who get sick is being discovered every day. Another difference with COVID-19 is that it causes more people who get it to become severely sick or even die. From what we know so far, some people have a higher risk of getting seriously sick from COVID-19. This includes older people and those with other medical problems, such as heart problems, lung problems, diabetes, high blood pressure, obesity, or those who have weakened immune systems. It is very important for everybody to do their best to stop the spread of this virus so we can protect each other, especially those most at risk. Even if you're young and healthy, you have a responsibility to keep not just yourself from getting sick, but also the people around you. This will help the healthcare system from becoming so busy that it is difficult to care for all of the sick people. Remember, hospitals are not only treating patients sick with COVID-19, they're also treating all the other things that people need healthcare for. An overly busy hospital affects us all. Right now, public health professionals in Canada and all around the world are using science and what we know so far about COVID-19 to make the best decisions for all of our well-being. These decisions include how to use the resources we have to stop the spread of the virus and track who is at risk. The decisions about who needs a COVID-19 test will change as we see where the virus is coming from and who is at highest risk. If you don't need a test at this time, consider that a good thing. It means that you are at lower risk and tests are being directed towards those who are at highest risk of getting seriously sick or spreading the virus. If things change, your healthcare professional will be able to help and decide again if you need testing or not. If you do get tested for COVID-19, in Canada, the Department of Public Health will contact you to let you know the result of your test, whether it's positive or negative, and give you instructions on what to do. While you are waiting for your result, you must stay isolated so that you don't pass on the virus. In fact, if you're feeling sick at all, whether it's COVID-19 or not, it is really important that you do what you can to prevent spreading your illness, just in case. It is also important to note that people can still spread the virus even if they don't feel sick. So if you're feeling well, you still need to follow the advice in this video or that given to you by your healthcare professional or public health. Next, we will talk about physical distancing and self-isolation. This is the best defense we have against COVID-19. So how is COVID-19 spread? COVID-19 is a type of virus that is spread by what healthcare professionals call contact droplet. The way people get COVID-19 is by getting tiny virus particles inside the body through their nose, eyes, and mouth. When people cough and sneeze, it releases these tiny virus particles into the air and onto nearby surfaces. These virus particles fall quickly out of the air rather than floating around for a long period of time. This is why we recommend that people stay 2 meters or 6 feet apart. That way, if someone sprays virus particles by coughing, sneezing, or spitting when they talk, the virus will not land on your face. The other way that people get sick is by touching things that have virus particles stuck to them, and then touching their face, which puts the virus in their eyes, nose, and mouth. This is why washing your hands regularly and properly is very important. You can wash your hands with soap and water or by using hand sanitizer with at least 60% alcohol. Most people cannot help but touch their face, so keeping hands clean and free of viruses by washing them while also staying 2 meters apart is your best defense against getting sick. You may see your healthcare provider wearing masks, gloves, and other equipment. The reason they do this is because they get coughed on all the time in the hospital or clinic. When you go out in public, you don't need a mask or gloves as long as you follow the physical distancing guidelines and keep your hands clean. Some experts are recommending that people wear masks when they are in places where it may be difficult to remain 2 meters apart, such as the grocery store. If you do decide to wear a mask, it is very important to be cautious and make sure you learn how to use it properly. A mask is not a substitute for physical distancing and hand washing, but may help reduce COVID-19 spread for people who have the virus but don't have symptoms. Remember, if you are sick, you should be staying at home. If you do get sick, it is important to do your part to prevent others from getting sick also. The best way to do that is to stay away from other people by staying at home. I repeat, if you're sick with any type of illness, please stay home. While you are sick at home, you need to do your best to also keep others in your home from getting sick. If you start to cough and sneeze, then you should do your best to try and trap the tiny virus particles from traveling through the air and onto other people or surfaces. This can be done by completely covering your nose and mouth while you cough, either by coughing into a tissue and throwing it away, or by doing the vampire cough or sneeze, by coughing into your shirt, like this. Mwah! Ha 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 ha! If you or someone in your house is sick, public health recommends that you try and stay in a part of the house that is separate from others. If you can, sleep in a different room and use a bathroom that others don't use. That is the best way to try and stop the virus from spreading. Now, we understand that for many people, this isn't possible, and it can also be very difficult to self-isolate in families with small children. If this is the case, then the same rules apply. Wash your hands regularly, try to keep surfaces clean, and keep your distance so that virus particles cannot travel to other people. For most people who get sick with a virus, including COVID-19, they will recover without needing any prescription medicines or treatment in a hospital. The best way to recover is to get plenty of rest, drink lots of fluids so you don't get dehydrated, and treat the symptoms to make yourself more comfortable. If you or your child has a fever and feels unwell, you can take over-the-counter fever medicine, such as acetaminophen or Tylenol. For more information on managing fevers, check out our video. Cough and cold medicines are not recommended for kids. Honey can help, but should not be given to children less than 1 year old. If you or your child are diagnosed with COVID-19, then public health will tell you what to do. You should stay isolated until public health or your healthcare professional says it's okay, because you may still risk passing the virus on to other people, even when you're feeling better. When you are sick, including with COVID-19, there are some important things to watch out for and reasons you should see a healthcare professional. If you are worried, it is best to call your local public health office or your doctor's office to get advice before going out in public or to a clinic or hospital. In Alberta, Canada, where I work as a children's emergency doctor, the number for HealthLink is 811. If you are very worried, then call 911 or go to the closest hospital. The most important signs to watch out for in viral infections, including COVID-19, are trouble breathing, which you will see as someone breathing very fast or using extra muscles to breathe. This includes sucking in between or below the ribs, sucking in around the neck, or the nostrils flaring in and out. If your child starts to have blueness on their face or around their lips, you should also see a healthcare professional immediately. If you are worried that you or your child is getting dehydrated, then they should also see a healthcare professional. The common signs of dehydration are peeing less, getting really dry in the mouth, or crying and not making tears. Ideally, a sick person should be peeing at least 3 or 4 times in a 24-hour period or a full day. Check out our video on diarrhea for more tips on how to deal with dehydration. If you or your child are getting really sleepy or lethargic to the point that they are difficult to wake up, passing out, or really not acting like themselves, you should also see a healthcare professional immediately. Remember, if you're ever worried, it is always worthwhile to get help and advice from a doctor, nurse, or other healthcare professional. In summary, most people who get viruses, including COVID-19, will recover fully without needing any special treatment. Even if you are not sick, it is best to keep everyone protected by maintaining physical distancing and by staying home except for essential needs. It is also important to keep your hands clean. This will help prevent you and those around you from getting sick. If you or someone in your family gets sick, you need to be isolated or quarantined until a healthcare professional says it's okay to go back out in public. If you have questions, call your doctor's office or public health office for more information. If you are worried that someone is very sick, call 911 or go to the closest emergency department immediately. Most importantly, stay safe and help everyone else around you. Remember, we're all in this together.